forever, you know, because the people that are dying obviously are the ones that are not well. I'm going to play you guys just a few little notes from some of my recent patients. See if I can pull that on.
I have improved greatly. I've lost immense amount of weight, about 30 pounds.
I've lost 17 pounds. I just feel better. I have more energy.
Following the program was really easy.
I have lost over like 30 pounds.
All my blood work was wonderful.
I love the approach.
It will give you more years to your life.
It's just amazing the difference that I have experienced.
The weight's coming off. It's just easy to follow.
My energy level has increased.
My cholesterol went from 205 or something to 154.
Arthritis is gone. My blood pressure is down.
A1C levels come down to a normal level.
Sorry, guys, technically challenged I am.
I
Let's
have
finish
improved
this up.
greatly.
I'll move this up to where we were.
It's just easy to follow.
My energy level has increased.
My cholesterol went from 205 or something to 154.
Arthritis is gone. My blood pressure is down.
A1C levels come down to a normal level.
I'm feeling wonderful. I have more energy.
I'm very thankful. I'm very thankful I found this program.
She definitely was at death's door. Can't thank the doctor enough for what she has accomplished.
I'm not here just for like one thing. She's dealing with all of it. And so overall, I'm better everywhere.
Within 6 months, I was able to go from not feeling so healthy and having no energy to exactly the opposite.
So guys, that's routine. That happens all the time, and it is not a rare occurrence. So our focus is going to be on stress hormones and health, and we are going to cover a number of things. I will explain to you a little bit about who I am, and I'll ask you if you would please to minimize distractions so you can really kind of focus and listen in. And as I said, I really would love to hear comments from you guys, so please put those in. We're going to talk about what's going on in our healthcare system and the current crisis, as well as the crisis that was in existence and has now just been heightened before the current COVID-19 issue arose. We're going to talk about underlying issues that nobody addresses. Of course, we're going to talk about stress hormones and health. And then we're going to talk about what you can do to protect your health naturally. And for those of you guys that stay with me through the webinar, at the end, I will offer to you guys a free 15-minute discovery phone call to kind of talk to me and determine if you and I might be appropriate to work together and see if I would have anything to help you and if I can help you to address your health challenges. So we'll have that for you at the end. You know, most Americans are on multiple medications. People over 60 are anywhere from 4 to 13 medications. And that's a serious issue. The medications interact with one another. The medications have a mechanism whereby they block certain reactions in the body. That's what all drugs do. They're designed to block some reaction in the body. Now, we know that the body works in a certain way because that's how it was designed to work. And if you block things, you're going to end up with problems like side effects. And so all medications will generally give you that potential for side effects. And unfortunately, that oftentimes leads from one side effect that, you know, is from one medication, and then another medication is added, sometimes to counter the side effect from the first medication. And it just kind of goes on and on. So I want to mention a patient of mine recently from about 6 months ago, Jerry. Jerry came into me and he was on 5 prescription medications, okay? By the time I finished working with him over a period of a few months, he came off his metformin, he came off his statin, and he came off of 2 antihypertensive medications. So I didn't just stop them and say, Jerry, you just don't stop, you know, take his primary care physician stopped them because his labs and his numbers and how he was doing improved so much, he didn't need it, okay? His energy, all of his GERD symptoms, everything got better. His quality of life improved. So there is a better way. Medications will not get you there, okay? The lessons that we're learning from COVID-19, geez, look at this. 90% of people that are hospitalized or end up dying from COVID-19 have a pre-existing condition, okay? 60% of Americans have a pre-existing condition. So geez, no wonder we are at extremely high risk. Things like hypertension, being overweight, okay? Obviously chronic lung disease, right? It targets the lungs. Diabetes, heart disease. These are the chronic problems that our population suffers from, okay? And what do we get? We get one drug after another. Does that ever solve the problem? No, it just perpetuates it. Where we are is totally unacceptable. The cost is crazy, right? We're the single most expensive healthcare system in the world, right? 3.5 trillion. Geez, you know, I think that's like, I don't know, 12 zeros. I can't even think in numbers that high, but that's our annual healthcare expenditure. 90% of this goes to chronic health conditions. So, you know, that's the diabetes, the heart disease, the arthritis, the autoimmunity, those things. And unfortunately, our healthcare system does not have the ability to solve those problems, okay? Drugs simply do not resolve them. So, you know, we're spending twice what other nations are spending, but we dying of these chronic diseases that we're unable to handle, okay? Our outcomes, even though we are spending more money than anybody else, are pretty pathetic, okay? If you look at the developed countries, right, we're right at the bottom, which is really, really sad. So, you know, what's the underlying cause? It's all about money. The current healthcare system, you know, if it wanted to resolve your bad health, it would, it could. We know how to do it, right? But it doesn't. Why? Well, there's too much money in keeping people sick. The system, as it is right now, does not want to cure people. It wants to manage their disease. So when you manage their disease, what happens is you just kind of keep them going. You put them on these drugs for life, right? We don't take drugs away. We just add one to the next to the next. And that's what goes. I have some folks that think, well, geez, you know, my health insurance doesn't, you know, wants me to stay well, so I save them money. And I tell you, it's a little more complicated than that. Your health insurance doesn't want to not pay out money. They make money based on how much money they pay out. So if they can keep 10% of profits of what they pay out, do you think they want to pay out $100 and keep 10, or pay out 1,000 and keep 100? Because they're going to collect what they pay out. They're simply going to raise their rates. So the whole system is perpetuated on making money. Outcomes for patients is not the priority. And I think it's time that everyone wakes up to that. A lot of people are. You know, I tell you, every single one of my patients, they know that they have to be responsible for their health. And if there's one message that I impart on you today, I hope it's that you are responsible for your health and the health of your loved ones. Do not expect that your doctor's going to do the best thing out there for you, okay? The doctor's doing the best that he or she can. That not necessarily the best that's out there. You know, the way doctors are trained, doctors are not trained in nutrition. They're not trained in lifestyle medicine. They're not trained in prevention. What are they trained in? They're trained in learning how to make a diagnosis and then prescribing the appropriate drug. That's what they spend all of our medical school years in, residency. And then we get out to practice, and the drug reps, continuing education through drug reps. Okay? Do you think they might be biased? Absolutely. Absolutely. And that's the only education the doctors get. So heck, no wonder none of the doctors know about the miracles that vitamin C can perform and the miracles that niacin can perform. They don't know that. They're not taught that. It's not in their way of understanding. Not only are they taught that, there's actually a negative bias. Anything natural is suppressed because you know what? If the whole population discovers all these natural therapies, what's going to happen to the need for drugs? They're going to go down. All right. I tell you, that I am not perpetuating a conspiracy theory here. This is the truth. So how did I get in this line and who the heck am I? So for those, and I know some of you guys on here know me and so hi. But those that don't, I'll give you a little background. So I came to the US as a little kid and my parents brought me here. Dad wanted to further his kids' education. We got here and you know, we lived the American dream. We worked hard, we studied hard, and we succeeded. I got to train at the Johns Hopkins Hospital, you know, one of the premier institutions in the world. My brother got to the Mayo Clinic, became a cardiologist there. And you know, again, we didn't come with any great wealth or resources. We came very simply and we worked hard and voila, the American dream is real. And so I was enrolled in a traditional type of medical school. I went to the University of Louisville in Kentucky, and then I did a year of general pediatrics. Then I did ENT head and neck surgery at the Johns, as we like to call it. During that time, I was feeling pretty good, but I started having some thyroid issues, hypothyroidism. I had this big lumpy thing in my neck. And oh no, your thyroid is borderline, nothing is needed, you're fine, right? Come back in 6 to 12 months. I kept doing that. And ultimately, it didn't work anymore. I couldn't go on. I did great in high school, med school, right? I had valedictorian, I worked hard and I could study, man. I knew how to take tests and get there. Got to residency and they almost let me go. They were looking to interview people to replace me. My husband was about ready to boot me. I couldn't do anything. Every step I took required a sheer act of willpower. And my labs were borderline. I get your pain, those of you guys that feel lousy, but you're told your labs are okay or your labs are borderline. You gotta look deeper, okay? So that right there, I had a blessing in that one of my med school professors had come up with a revolutionary new way to address the thyroid. And he taught me and kind of got me my life back. And I was able to stay in my residency and fulfill my dream of becoming a doctor. And as I am doing this, my mother started to get sick. Chronic disease, right? Ulcerative colitis. She had Wegener's, all kinds of, you know, arthritis, all kinds of things going on. And the conventional healthcare couldn't do a heck of a lot for her. Over time, she suffered. And I had no choice but to seek out answers for her suffering. And that kind of put me on a path to learn more and more and more. And so my conventional background then, seeking more answers, led me into functional medicine. And that's kind of now all I practice, okay? So what I tell everyone, and my motto is take charge of your health. Right? We can't completely avoid exposure. I don't know how long people are going to bring their grocery home, wipe them down, and then, right? This stuff is so dang, contagious. I don't know how long. It's a matter of time until it circulates through the whole population. Of course, they're having us hold on to our seats until this awesome, incredible, life-saving vaccine comes out. I won't mention vaccines anymore. But the approach I want to present is that kind of in the other direction here. Let's be proactive. Let's get to prevention. Let's get the right information. Okay. We're so restricted as to what we can say, because if I say, these vitamins will help support your immunity, then I'm accused of fake news. So it's crazy. The information you're allowed to get is being severely censored. And you think, geez, I'm in America. I'm not in China. I'm not in Russia. Yeah, but I tell you, things are changing. We need to eliminate risk factors. Nobody's talking about that. Nobody's talking about get in there, get that diabetes under control, get your blood sugars under control, right? Get your blood pressure under control, eat the stuff that's good for you, boost your immunity, right? Minimize the effects of negative stress, take charge, okay? That's gonna be kind of my preaching motto as we go further here, okay? So what do we take charge with? Okay, we take charge with the pillars of health. Okay, so you see them listed there. I think these things have to be addressed. You can't just eat the perfect diet and be perfect. You know, if you're not addressing the other things, you're not going to get better. You have to address everything, and that's what I've learned. One little, kind of tunnel vision approach doesn't work. You've got to take the whole, lifestyle factors, the emotional factors, so your mind, body, spirit, everything has to be addressed in order to get your health back. And we'll talk a little bit more about that. So for those of you that are joining in as we're kind of going on forward, we are starting to talk about America's healthcare crisis. We're starting to talk about underlying causes that nobody's talking about, like how unhealthy we are and how our healthcare system, what its focus is on. We're going to get into stress hormones and health. Haven't done that yet. And we're going to talk about what you can do to take charge of your health. And for those of you that are here till the end of the presentation, I'll give you an opportunity to schedule a free 15-minute call with me to see if I may be able to help you with your health, okay? So our current approach, right, the first thought comes to mind. What medical condition does the patient have? What is the diagnosis? When I was in residency, it was a big thing, right? We had to learn how to make a diagnosis. Once you make the diagnosis, you can just look up what drug do they need. That's basically the current system. The pharmaceutical companies spend billions marketing to doctors and marketing to you, marketing to people, marketing to patients, which by the way is illegal in Europe and it should be illegal here. Ask your doctor about this. What kind of nonsense is that? So all of these chronic conditions that people have, diabetes, hypertension, hyperlipidemia, right? Autoimmunity, what does that do? Prescriptions for life. Geez, what more could a drug company want? So, with this kind of an approach, the way the healthcare approach, as I said, it seeks to manage your disease. It does not seek to cure it. It's kind of like, let's say I'm driving home, right? I'm driving home and my car's check engine light comes on. So I take it to the mechanic and the mechanic hooks it up to his little diagnostics and then he turns off the light. He sends me on my merry way. But when I'm driving home or the next day, what's going to happen to that light? It's going to come back on. And why? Because he didn't fix the problem, right? He just turned on the signal. So you go to the doctor with high blood sugar, high blood pressure, high cholesterol, whatever it is, and the doctor gives you a medication. What's going to happen the next day when you don't take the medication? It's going to go back up. Why? The medicine didn't fix it. It's turning off the signal. Why is the blood pressure high? Why is the cholesterol high? Why is the blood sugar high? Nobody asked that question. Our system, that's not what we teach doctors to do. And that's what we're missing out on. Okay? So here's something straight from the horse's mouth, Medicare. Everybody wants to know, well, geez, why doesn't, mine, or everybody thinks that, hey, if it's good and if it's good for me, my insurance will cover it. Medicare says care that seeks to prevent disease, promote health, and prolong and enhance the quality of life is not considered medically necessary. Well, if that's how you want to live, the choice is yours. But your health insurance is not there to keep you well and to make you healthier and improve your quality of life. Your health insurance is there in case things crash. If the house catches on fire, the homeowner's insurance kicks in. But you want an updated kitchen, it's not going to cover it. Same thing here. So health insurance no more provides health than life insurance provides life. That's not what they're for. And unfortunately, they have us programmed into thinking that that is what they're for. So why? Because they don't want us seeking out natural alternatives. They don't want us getting healthy, because if we get healthy, how many of us really, then a fourth of our population isn't diabetic, right? They're not diabetic or pre-diabetic, because that's what the numbers are right now. 10% have frank diabetes and 25% have pre-diabetes. So if you don't have all this, well, geez, what happens to all the drug sales? They go down. What happens to all the statin sales? They go down. So the system doesn't want that. The system doesn't want to pay for prevention, promoting health and prolonging and enhancing life, but the system also doesn't want you to go out there and do it, which is really criminal if you ask me. So, the current system has kind of put us in our current state of affairs. And the question is, if we want to stay in the current system, are we really going to expect it to do something different? I love Einstein's quotes, and this one I think is right on. If you keep doing the same thing, but you're expecting a different result, then the problem lies with you, not with the system. So you have to understand what it is that the system is doing and seeking to do, and you have to make your decision. That's, in my mind, the key. And the question is, can we do something different? Okay. I'm going to let you hear from another patient of mine.
Okay, I first came to see Dr. Kadir it was August 15th of 2019. I actually really did think I was going to die. I was on 200 units of insulin a day with 300 blood sugars. And she just started me on a routine, slowly started me on a routine, taking, all of the blood samples, doing all that first. And little by little, within 24 hours, I had no acid reflux, which was amazing to me because I'd had it for years. And within 48 hours, my blood sugars were normal again. Well, I don't know, I must be down 30 some pounds, and my energy, so, it's coming back little by little. I'm back up, I'm cleaning my own house again, don't have to hire it out, going out with my friends again. When I first came here, it was a 9, not quite 90 days ago.
Talking about A1C.
6.6, which tells me in another month or so, I'm going to be in the normal blood sugar. I'm going to be 5s again.
So it can be done. And the question is, are you motivated? What's your why? Why do you want to be well? Why do you want to be healthy? Why do you want to live? Okay. I got my whys. Those are my kids. I've seen them graduate, and I want to see them getting married. I want to see grandkids. I want to do things. I want to travel. I got lots of whys. But, that's people that I work with. They have to bring the motivation. I can't give you motivation to get well. But most people come and they know what they want to do. They know why they want to be there. Okay? They just don't know how. And that's what we help you with. So let's talk a little bit about, symptoms. Here's a really common one: feeling tired and sluggish and fatigued. Okay? It's a pretty common scenario. And why the heck does that happen? There's lots of reasons, right? Thyroid is, of course, a big one. That was the issue in my case, right? But you can be toxic. You can have an adrenal problem. You can have a nutritional deficiency. But if you go into your doctor, they run the basic blood count, the chemistry panel. They might do a TSH if you say you're fatigued, and they're going to screen your thyroid, right? But that's a pretty minimal way of looking at the thyroid. And then they tell you your lab results are normal. Well, geez, oh, you're just getting older. That's what you get. So by investigating further, getting down to the root of the cause, really listening to that patient. They kept telling me I was borderline. Man, my life was getting destroyed. So I knew that was not normal, but I couldn't get help. I got lucky that I found help, but without that, it would have been horrible. So lots of reasons: toxicity, as I said, nutritional deficiencies, thyroid, adrenal. And all your doc is going to do is check, make sure you're not severely anemic with the blood count, and make sure your liver and kidneys are working, and screens your thyroid, and they stop there. Okay. Another really frequent issue: bowel problems. Geez, irritable bowel. This is one of my favorites, because they call it, well, it's your diagnosis. You have irritable bowel syndrome. It's like saying you have fever. Well, geez, why the heck do I got fever? Do I have pneumonia? Do I have a kidney infection? Do I have, sepsis from a big boil that's infected on my arm? It doesn't tell you anything. So why is the bowel irritable? All right. Is it a food sensitivity? Is it a dysbiosis with an imbalance in the normal gut flora? Is it, is it because you've got some kind of an infection? Is it because there's a nutritional deficiency? Okay. You got to get to the underlying cause, and that's what our current system fails to do. Okay. So all kinds of issues when, chronically constipated. I'm just starting with a new patient. She tells me she has a bowel movement every 7 to 8 days. Jesus. No way you can be healthy with that degree of constipation. Okay. So the gut, if the gut ain't happy, ain't nobody going to be happy. Okay. It really is the key to health. They say all disease begins in the gut. Now, the interesting thing is not everybody has gut-related symptoms. Okay. Somebody's gut might be the cause of their arthritis, but they might not have any diarrhea, constipation, belly aches. So it's tricky. Needless to say, it takes a little bit of investigative effort to get to the root cause. And usually there's not drug prescriptions involved. And so the current system really doesn't want to go there. Depression, anxiety, huge. Okay. They're now saying leaky gut, leaky brain, right? If you get inflammation in the gut, you are going to have an inflamed brain. An inflamed brain is not a happy brain. It's going to be depressed. It's going to have mental illness. Even psychosis can relate to problems with inflammation. The psychiatrists widely now admit inflammation is a problem, but they don't do anything about it. They don't know what to do. All they do is still keep throwing their same drugs at the patient. The patient doesn't have a Prozac deficiency. Patient might have a vitamin D deficiency, and that's why they might be depressed. Okay, so unfortunately, our system doesn't go there. There's no money behind going there, and so the system doesn't want to go there. Insomnia is also huge, right? So why are we having insomnia? Well, lots of underlying issues there. You got to figure out what it is. Is it because of chronic stress and adrenal problems where the person's making too much cortisol, and the cortisol spike is occurring at 2 a.m. instead of 6 a.m, and so you can't help but wake up at 2 a.m. Okay. The chronic inflammation leads to a deficit in melatonin, and that's another mechanism. So our sleep-wake cycles get totally messed up. So this is another resulting severe problem, because if you don't get enough sleep, your body is not going to recuperate well. So obviously weight is big, right? It's a big problem in our country. If before COVID-19, you could go to Europe, you walked around there, you could tell exactly who the Americans were because they were bigger than everybody else. So, it's a combination factor. Don't tell me it's in our genes. You know, we've had the same genes for hundreds and hundreds of years. They haven't changed that much, but we sure have. So you have to think, it's not just genetic, okay? Yes, you have genes, but your lifestyle and your environment trumps the genetics. And so you can totally control which genes are expressed. This is something we call epigenetics. A lot of research going on in this. So you can modify whether your good genes are active or your bad genes, the cancer causing genes or the cancer suppressing genes. How do we do that? Well, geez, you know, food, stress management, exercise, okay? We'll talk about a little bit of these things. So testing is important. I test a lot, and I interpret the labs also very differently from the, you know, the standard report comes in with normal and abnormal, okay? They plot out this bell-shaped curve to everybody. The 2% at the top and the 2% at the bottom are considered abnormal. Everybody in the middle is normal. Well, you know, if I tell you that 25% of our population is either pre-diabetic or diabetic, you're going to call them normal too? So the whole normality gets skewed. We have these huge ranges. So if we really look for optimal or what's called functional lab values, they're going to be much more sensitive. In general, I do a ton more testing than conventional, you know, annual checkup with your family doc. That's only about 5% of what I'm looking at, right? They're looking at the blood count, they're looking at a chemistry panel, looking at a lipid panel, and maybe a TSH, if you're lucky. I'm looking at your micronutrients, I'm looking at all your hormones, I'm looking at an extended thyroid panel, right? I'm looking to see if your adrenals working. If you're having gut issues, we might be doing food sensitivity testing. These are all what we call functional lab assessments, okay? But they do not make their way into conventional medicine because they do not lead to drug therapy. I'll be frank with you. Okay, so talking about the lab ranges here, we're going to talk about testosterone and talk about on the bottom, that's talking about cortisol. So testosterone is a blood test that, you know, some doctors will run if you ask them. Generally, they won't spontaneously. And there's a normal range, and it's usually not even 300. It's usually like 280, you know, up to 1100 for some labs. And as long as you're in that rough range, they're going to say you're normal. Well, if you're a 35-year-old man and your testosterone is 350, you sure as hell ain't going to feel normal. All right. If you're 85, 95, okay, then a testosterone of 350 might be acceptable. Okay, because it does decrease with age. Okay, but the lab ranges don't give you that information. Plus, some men are inherently at higher levels than other men, and that's their baseline. So naturally they are there. So we don't know. Well, did you always, you know, were you a fellow who's always been around 650, or were you somebody that's always been around 900? In which case 600 is not going to feel right for you. Okay, so everything has to be interpreted with detail, not just look at the range on the lab report, which unfortunately is all that happens under most conventional practices. The bottom test that is showing you there, normal curve in red, and then you're seeing the little curve with the little dots on it. This is a salivary cortisol test, 4 points, each one looking at one specific point in time. The first one we usually do 8 in the morning, 12 noon, 4 p.m., just before bedtime. And if you do not have this pattern that's in the red line, it's indicating that your adrenal axis is not working right. Your circadian rhythm is off, okay? Often this has to do with chronic stress and how you are handling it or succumbing to it, okay? And this is something that conventional medicine ignores. They think this is testing is voodoo. They do not do it, okay? They wait until you really have nothing and you are what I would say horizontally ill. You can't even, you're so sick you can't even walk around. Okay, yeah, you have a cortisol problem, which you can get on an autoimmune basis, but chronic stress that leads to what I call adrenal fatigue and what functional docs call adrenal fatigue, conventional medicine doesn't believe in. So if we don't do these tests, We're not going to identify the underlying cause. Okay, so you're tired, not because of your thyroid, but because of your adrenal. But I don't know that unless I look. History gives me a tip off. It gives me enough information to know what test I need to order. Okay. So in order to figure it out, we got to test, right? Is it a thyroid issue? What's the metabolism like? Is there diabetes, pre-diabetes? You know, that's another big one where they wait until the blood sugar goes bad before they'll say you have pre-diabetes. No, the insulin starts to rise way before that happens. But that's not part of the standard of care, right? So if doctors were taught to measure that before, just instead of looking at just the glucose and the A1C, we would catch this way sooner. Okay, and then we can kind of say, hey, you better start making some changes. You're going down the wrong road here. Okay, but if you look at the overall system, the system makes money the more diabetics that are in the system. Because diabetics, man, they bring a lot of stuff, right? They got lots of drugs, they got insulin, then they start having complications, right? Then they need amputations, then they need dialysis. Doesn't end there, does it? Adrenal stress, and that's what that adrenal test I just showed you, hormone imbalance, you know, very common. Premenopausal women, postmenopausal women, men. There's so much toxicity that the testosterone levels just keep dipping every year. The poor men, they're just wiped out. Excuse me. Food sensitivity, that's another thing. Conventional medicine doesn't believe it. They believe in food allergy, but not sensitivity. I see food sensitivity causing all kinds of symptoms, from headaches to mood disorders to obviously that irritable bowel syndrome to nasal symptoms, right? Vitamin deficiency, again, can present a lot of different ways. Toxicity, you know, if you're chronic, you know, geez, things like lead and mercury, they give you hardening of the arteries, atherosclerosis, heart disease, but nobody checks. And we have a huge problem with lead. Everybody's heard about Flint, but it's not just Flint. Hundreds of counties in the US have toxic lead levels in their water. So if you don't look for it, you're not going to find it. Chronic infections, chronic viral infection, Epstein-Barr virus, right? Mycoplasma, these things can cause issues. And again, not believed in, right? Not tested for. So you never get to the underlying cause of that fatigue. Okay. Talk a little bit about stress, types of stress. There are multiple types of stress, and stress is not inherently good or bad, right? It's how we respond to that stress. So let's kind of start with physical, and then we'll talk about the other types. So physical stress, exercise, you know, is a good physical stress. So it's good. But if we're in an accident and we're injured, that kind of physical stress sets up responses in the body that in the acute phase immediately are beneficial. But in the long-term chronic phase, okay, if that physical stress doesn't go away, those responses end up becoming damaging. Damaging how? Damaging by causing things like hypertension, diabetes, cancer, right? Because of the hormonal changes that occur, okay? Chemical imbalance, well, geez, all the drugs that your liver has to metabolize, that's a lot of chemical exposures. It's not just tobacco, smoke, and alcohol, okay? Our agricultural practices, you know, I don't know if you guys know this, but we allow our farmers to hose down fields of wheat 3 days before harvest. So what does that mean? That means you got Roundup on your wheat, sprayed it within 3 days of harvest. And when you're eating that nice bread, right, you are having a nice serving of glyphosate or Roundup with it. And Roundup's been, you know, it's a carcinogen. And there are hundreds of lawsuits against that company now for cancers that are supposedly caused by this, okay? And that's going to be the only way to get a handle on it is the lawsuits. Now, The curious thing about the body's response to stress is it doesn't matter whether it's physical, chemical, or emotional stress. The body generates the same hormonal response. Okay, so whether you are burned, right? Some hot oil got spilled on you accidentally, right? And you got a 40% body surface, second degree burn, or your boyfriend breaks up with you, or you get a divorce, the body reacts the same way. The stress hormones respond similarly. Okay, so it's definitely something that needs to be addressed. And if we do not have healthy stress responses, we are in trouble. They say upwards of more than 75% of all visits to the doctor are somehow related to stress. It's a huge cause of our chronic disease. And we are more stressed than ever before. And the more, faster our life has gotten with all our electronics and, electronic leash, as I call it, the beeper and the cell phone, the worse this problem has become. So one of the things that everybody's always interested in with stress and hormones is belly fat. Okay. So first of all, what is belly fat? Belly fat is that evil fat that forms in between your abdominal organs. This is not just under the skin. Okay. This is not that pinch the inch kind of thing. This is where you have a thick protuberant belly that's hanging over your belt line, right? That kind of belly fat, that is dangerous. Okay. It's associated with heart disease, associated with diabetes, associated with all kinds of inflammation. Okay. And how do you get rid of it? It's the hardest kind of fat to get rid of. Okay. It takes a holistic approach. You got to address, okay, all of these, because all of these cause that, right? The way you eat, the processed foods are going to cause belly fat. All right. Lack of exercise is going to cause belly fat. You're not moving. Toxicity, right? We are just inundated with how toxic our environment is. Everything from our air to our water to our makeup to our food. Hormone imbalance. A lot of the toxic chemicals actually feed into hormone imbalance. Obviously, stress feeds into hormone imbalance. The stress and sleep, those issues are critically important. Most of us don't sleep enough. Okay, if you don't sleep enough, not going to heal enough, right? If you don't address all of these issues, you're not going to be real successful, no matter how much, Jenny Craig you do and how much of, these other programs. It's not going to work well, okay? I put genetics down there way little. Yeah, there's a genetic tendency, but that genetic tendency has been there for hundreds and hundreds, if not thousands of years. But we weren't eating what we were eating. We weren't sitting idle watching TV all day. And so it didn't manifest as obesity. So it's different now because of our lifestyle. So that's why I kind of minimized genetics down there, saying these factors. So if we want good health, well, geez, these factors tie right back into those pillars of health I showed you earlier, right? So in order to gain your health back, get rid of belly fat, right? Get your energy back, right? Cut the inflammation, cut the pain, get the gut working right. All of these things have to be addressed. As I started learning way back when, I would, whatever I learned, oh, let's do this. Well, one thing at a time didn't work well. You have to address everything. You can't just, oh, I'm just going to eat perfectly, but I'm not going to move. Ain't going to work. You got to look at everything. And so when I'm working with a patient, I am looking at everything about that person. And I pull everything together and it's like, geez, I feel a ton better, but what was it? It was the combination. Okay. So let's talk a little bit about these 5 pillars. So nutrition, right? We have choices that we can make. Okay. The whole idea is to maintain life and growth. Well, you can get calories on the left side there too. But is it going to be good for you? In the long run, no. Is it going to cause arthritis, heart disease, diabetes? Yes. On the right side, are we going to be able to reverse those things? Yes. Okay. So making the right choices is obviously critical. Most of us know, but it's hard because this You know, I like to say our food industry makes money making us sick, and our healthcare industry makes money keeping us sick. It's sad, but I really think that is true. So everything that you see advertised, everything from that green ketchup to whatever the heck, right? It is no good. How often do we see broccoli being advertised? Okay. I ask everyone that I work with, you know, about exercise and what they do for exercise. I'm sorry, walking the dog, especially like this, not exercise. Okay, so you know, you doing your chores and stuff doesn't count. Okay, exercise science has progressed a long way. We know exactly what works. You know, if you will give me 3 days a week of about 40 minutes, I can teach you how to exercise optimally. And that's all you need. You don't need, you know, 4 hours a day at the gym kind of nonsense, okay? Or 2 hours at the gym every day kind of nonsense. You just need that little bit of time, but you got to exercise smart, not hard, okay? And it is key. Food, all the nutrition in the world is not going to replace what exercise is going to do for you, okay? So must be included. Detoxification, again, key. The gut and the liver, really, really important. Obviously, there's some detoxification that happens all over the body, but these two organs by far are critical. We are exposed to so many toxins that they handle, and we survive because they handle them. But we have really gotten to the point that we are starting to exceed their capacities. And the human canaries among us are dying. They're the ones getting sick, okay? So hormones, they are extremely potent. They are so potent that they can literally take over and determine the shape of your body, okay? An estrogenic body type, right, is where it's pear-shaped classically. So you have big hips, right? And it's not a primarily belly protuberance. And this is associated with problems with detoxification. It can be associated with chronic gut problems and so forth, okay? Obviously, risk for endometriosis, breast cancer, fibroids, that kind of stuff. In men, prostate issues and things of that nature, okay? Men have estrogen problems too, and I can tell you, a lot of older men will have estrogen levels that I'll tell them, hey, you know, your wife would be envious of you for this estrogen level, because with more body fat, men make more estrogen, and that's where the man boobs and stuff comes in. Next body type, looking at the adrenal. So when your cortisol levels are chronically high, it's that stress hormone. Without cortisol, we wither away and die, but with too much cortisol, we get into trouble too. Okay, an extreme cortisol condition is called Cushing's syndrome, and that's where you actually have a tumor that's making a ton of cortisol. And that is really, really bad. And Cushing people, they'll get a big hump up here behind at the lower part beneath their neck, a buffalo hump they call it, and they will have these scrawny little arms and legs and big mid portion. Thyroid body type, kind of just diffusely heavy. And the liver kind of looks a little bit like the adrenal, except the arms and legs aren't as skinny. And that's a detoxification problem. Fatty liver is huge. You know, fatty liver is more of an issue now than alcoholic liver disease. So these issues are huge in terms of their impact on health. And of course, you know, stress. As I said, more than 75% of all doctor visits are somehow related to stress. It's huge. It's huge. If you do not learn how to optimize your stress level, you're not going to be able to lose weight. Diabetics' blood sugars go up with their cortisol level, okay? Your coffee, caffeine can actually raise cortisol. So you got to watch all of these things, and we got to bring these things under control. So we got to teach patients how to lower these cortisol levels. We got to teach stress management techniques. If we don't, you know, I can put you on the best in the world, and by itself is not going to work, okay? So when you put everything together, it works. Okay. This patient, one of the things I did for her was manage her thyroid. And as I managed her thyroid, her aches and pains went away. Okay. Her energy, of course, got better and her weight came off effortlessly. So when you put everything together, it resonates. Okay. So I have found that you cannot help a person completely unless you address that whole person. You've got to address every one of those pillars in order to get there. Okay. And in order to do it, you've got to have a system. You've got to have an approach. Okay. This is, not that easy because every one of us is wired differently. Every one of us has a different history. Every one of us has different emotional backgrounds. Okay. All of that has to be taken into consideration. If it was a cookbook thing, I would write a book and retire. But every person needs individual attention. They need a coach. They need a mentor to guide them through this process. If you wanted to learn how to fly a plane, you couldn't just read a manual and do it. Somebody got to teach you. And the same thing I find with health here. And I find that once we teach our patients, they do great. But we got to teach them how to take charge of their own plane, of their health, so that they use doctors more as consultants and not really depending on them or expecting them to restore their health. You got to take charge, okay? And you got to do it systematically, okay? So I would suggest that you wake up and do not procrastinate. The fat cat's got 9 lives. You don't have 9 lives. And so you want to make the best of what you got. I saw a couple today that came in that are going to work with me. They are both riddled with chronic health problems, and they see how limited they are. The golden years are not so golden when you can't move around anymore. You get short of breath, you have no energy, you are starting to be dependent on a walker. All right, they want to turn all that around. And so you have got to take charge, take responsibility. That's how you're going to turn it around. And that's how you're going to get rid of belly fat. That's how you're going to get your energy back. That's how you're going to get your gut to move, right? It's all tied in. It's all tied in. And every time when I'm working with a patient, every time I see them, they do a full symptom survey. I want to know where everything is. Okay. It's not like the conventional healthcare system where you go in, okay, this appointment's about your blood pressure. We'll schedule you back next month and discuss your diabetes. Body doesn't work that way. We got to address everything. We got to address the person.